So I'm very pleased to be with you today and to be sharing the Enabling Inclusion model and app and the integrating the ICF in family-centered, community-based approach for early intervention and child rehab. So I'm presenting also on behalf of the team at Amar, Seva, Sangam with the Enabling Inclusion program. So welcome to South Tamil Nadu and our Rangoli that we have welcoming us at the doorstep of homes that we visit in the village-based program. So our outline today is to firstly cover the current concepts of disability and child development. We will review the development of the Enabling Inclusion model, then the essentials of family-centered care. Then I will cover the WHO's International Classification for Functioning Disability and Health, the ICF, and the F words for child development. Then I will go into greater details into the Enabling Inclusion model and app. And finally, we'll have some time for discussion and question and answers. So we have our children at Amar, Seva, Sangam welcoming us, and we will cover the current concepts of health, disability, and child development. So looking at what is the past thinking of the medical model of disability, where the problem is the disabled person. And the diagram here shows what the challenges that were faced by the medical model of disability, where the problem was not the environment, but the person and the person with the disability and being in a handicapping position with this model. So from there, from the medical model of disability, we went on to the social model of disability, where the problem is the disabling world, the environment, the isolation, the inaccessibility, discrimination, and lack of access of the world and the schools and the community. So that is our social model of disability. And we still now have a mix of medical model of disability and social model of disability. But I propose to you moving beyond that. So this is where we see our traditional model, where the person is the problem with their disability. And we have the social model where the problems are the barriers in the environment. So again, a reminder that barriers can be the environment itself, the physical environment, maybe the attitudes, and maybe organizational or policy related practices as well. So just to give you a bit of the background of how far we've come from the charity model to the medical model to the social model. And what we want now and want to move towards is the human rights model, of course. And the human rights model goes beyond the social model of disability. So it is not only to enable the environment, but also to empower the person with disability. And to have true inclusion and livelihood activities and full access to services and participation in every aspect of life. So just a reminder, who is a person with a disability? And you might say that it's somebody who has a long-term physical, mental, intellectual, sensory impairment. But what makes that person be a person with a disability is really the interaction with the various barriers that hinder their full and effective participation in society. So we really have to keep in mind that what makes them be a person with a disability is really the interaction with the environmental barriers, societal barriers that hinder their participation. And it goes on to think of what inclusion really is defined as. Well, inclusion for either a child or an adult is to be able to fully participate and actively participate in both home, school, and community activities. And where necessary, there's appropriate supports that may be provided to ensure full and active participation. So this is what we aim for, is full participation in every aspect of life. Now moving on to the children. So of course, our definitions of child with disability are all these various aspects of disability that are classified as such. And we have to keep in mind that many of the children that we do see may not have specific, may not have even one of these. They may have a developmental delay that may be related to more of the environment in which they are being brought up. It may be nutritional deficiencies, maybe for various reasons, they might have developmental delays that may be caught up if provided with proper early intervention. And they may as well have a defined disability. So for any of these, what the family needs are supports. The child needs special education and community services to maximize their inclusion. So if we look at the rights of person with disabilities, it does define that we want to have respect for dignity, autonomy, for each person to make their own choices and be independent. No discrimination, full and effective participation and inclusion. We want respect for differences and acceptance of persons with disabilities. Equality of opportunity, accessibility, and equality between men and women or boys and girls, and respect for the evolving capacities of children with disabilities and respect for their rights to preserve their identities. So whether or not it's a child or an adult or a boy or a girl, that they may have the equal rights of person with disabilities. So let's look at perspectives of disability in the Indian context. We know that religious beliefs, as in many countries around the world, perspectives of disabilities may be impacted by religious beliefs, whether it's parents thinking at times that it's the curse of God or God's will or punishment for sins or karma, and maybe the reason for them having a child with a disability. There may be cultural beliefs that are defined by traditional practices or myths or superstitions or attitudes towards disabilities. Each family may have different perceptions of the disability. And again, we go back to the medical model where families often are looking for a cure for whatever special needs their child may have. And we also look at the impact of the environment. If the environment is more restrictive, not inclusive, then you end up with disability or handicap. Handicap being a limited ability to participate in every aspect of life. And the social context, where society's perceptions, reactions, and stigma may impact the person with disability or their family's perspectives. And lastly, barriers to participation in inclusion, as we have seen in the social model, whether it's at school, community, or even in the home setting. So we have to keep in mind all those various aspects that may impact a family's perception of disability or the person with disability or the child's thinking as he grows older. So let's turn our minds now to what the 21st century thinking in terms of child development and disability is. We want to turn our minds to thinking in terms of developmental differences rather than disability. Each child progresses at their own pace. Each child may have differences where the norm is quite broad. All of us who have worked for years in the field of pediatrics or child development know that the normal, quote unquote, normal is quite broad, and there are often many developmental differences in children. So we have to look at it first in terms of developmental differences rather than thinking of it as being a disability. It may be just a developmental delay, and it may be a differences in their trajectories. We want to think in terms of promoting development rather than thinking of rehab or therapy. A child who has not yet acquired certain skills doesn't need to be rehab necessarily. The child has not lost function. It is not like an adult who had a stroke. So we want to keep building, putting together those building blocks to promote development rather than thinking of it as being rehab. And we want to think of the total child, the child as a whole. So not just the child in terms of their gross motor skills, speech, fine motor skills. We think of the child developing all of their abilities and skills as a whole. So we want to use a strength-based approach. Rather than looking at what is missing in the child, let's look at what skill he does have. Whether it's a toddler, a school-age child, an adolescent, or an adult, we want to look at what the person can do before we can think of what the person cannot do. So we focus on function and participation, not just on impairments. So again, it's a shift of our attention from disabilities to abilities and potential. And I will be covering this today, how to go about thinking in this way. So this is our friends at Amar Seva Sangam celebrating Diwali. And this is the true meaning of participation. So let's look at the development of the enabling inclusion model. So how did Amar Seva Sangam come about developing the thinking behind the enabling inclusion model? The global health issue is that children under age 5 with disabilities comprise 52.9 million globally. And in India, the statistics were 2.3 million children with disabilities under the age of 5 are there. So that is something that we need to address, whether it's in India or globally, or all those children under age 5 that really need that early intervention and care, as well as their families. Now, if we narrow down to the problem in Tamil Nadu, where again, the high numbers of children, over 100,000 children under the age of 6 with disabilities, and that the government of Tamil Nadu urban district early intervention centers were again in urban areas, but not in the rural areas of Tamil Nadu. And we know that 53% of children live in those rural areas. And then in those, we know that then there's no EI therapy program for those children with disabilities that live in rural areas in Tamil Nadu. So this is the thinking that Amar Seva Sangam developed, or that was looking at when they developed the enabling inclusion model, thinking that this is a problem that needed a solution. Another statistic is that looking at school enrollment, 72% of 5-year-old children in India with disabilities have never attended any educational institution or any type of program. So there's a need to get those children ready to be able to attend school for inclusion into home, school, and community. Another thing that came out was in 2018, the WHO, UNICEF, and the World Bank Group developed the nurturing care for early childhood development. And they were looking at children from 0 to age 3, and what is so important in that nurturing care framework. So we have good health of the child, adequate nutrition, responsive caregiving, safety and security, and opportunities for early learning. So all of those components are very important in those early years. So again, this is why we feel that early intervention is so important to get a good start for each child. So the strategic actions that they developed were that to lead and invest in children, to focus on families and their communities, to strengthen services, to monitor progress, and to use data and innovate. And this is what Amar, Seva, Sangam sought to do. Now, this picture, it reminds me of seeing those trucks fully loaded on the road, not such as this one, but this represents to me often how families of children with special needs or disabilities feel the overload of the burden of care and the necessity for us to look after both the child and the family in any services that we provide. So looking at how the early intervention program was developed by Amar, Seva, Sangam, it was initially called the Mobile Village-Based Rehab Initiative, or MVBREI. And it was in the the Tenkasi district of Tamil Nadu. And the rationale for home-based services was that families had many travel distance and time needed to access services in urban centers was quite far. Transportation options were limited and costly. And oftentimes the child's functional limitations prevented families from traveling so far. Child was non-ambulatory or may have had behavioral difficulties. There's lack of mobility, assistive devices, societal stigma. Often the families did not want to take the child out of the home to take them to access services in urban centers. And often the family's livelihood and other childcare needs prevented them from traveling to urban centers. So what Amar, Seva, Sangam did is we partnered with some of our research partners, some of them the universities in Canada, University of Toronto and McGill, as well the Harvard University Center on the Developing Child, Handicare International, who is our funding partner in Canada, and as well as Kalasalingam University in India. We also developed many funding partners that were there along the way and still are with us to develop the Enabling Inclusion app. So why the Enabling Inclusion model? Well, it's an innovative and evidence-based service delivery model for providing community-based early intervention services. And our guiding principles were to follow the WHO's ICF, because the ICF, as we will look at a bit further, optimizes health, function, participation, and it also looks at the environment and personal factors. We wanted also to have a model that included the family-centered approach, His family-centered approach recognizes that child and family well-being are interrelated. And lastly, it had to have the strategy of community-based rehab. So CBR that aims to meet the basic needs of the child and family and also facilitates participation and social inclusion. So our model needed to have these three guiding principles. So the ICF, which we will cover a bit more in depth, and family-centered care, which with all its elements of building on family strengths and acknowledging that the family is a constant in the child's life and needing to support the family as well as the child. And community-based rehab as a strategy to empower the family and as well as the community, self-advocacy, inclusion, and participation within their own setting. So those three elements needed to be present. So we integrated the family-centered care, CBR, and ICF to develop our model. And that's how we best are able to maximize each child's potential for functional independence, participation, and inclusion, as well as family empowerment and capacity building, and with the community awareness that is needed as part of that CBR strategy. So the Enabling Inclusion solution was developed in 2014 for community-based early intervention services. And it was named the Enabling Inclusion Model. And since then, we developed a digital health solution to support those services, which is called the Enabling Inclusion Application. So I will now move to more precisely into the elements of what is so important within our model. First of all, the essentials of family-centered care. And this is a family who is very dear to my heart. So I visited them in their home. So looking at family-centered care premises. Firstly, parents know their children best and they want the best for their children. Hello. Is there some? So our guiding principles is that parents need to be involved in decision making, and parents should always have the ultimate responsibility for their care of their children.
Requesting participants to mute their mic.
Please mute. Now, the second element of family-centered care is that each family is unique and different. We cannot compare. Every family is different. So each and every family member should be treated with respect and as individuals. We have to respect their culture, beliefs, attitudes, perceptions of disabilities. Our third premise is that optimal child functioning occurs within a supportive family and community context. So we need to consider the needs of all family members. We need to involve all family members we need to involve all family members, whether it's in a treatment plan or in providing support. We need to consider the family as a whole. So this is just a diagram that shows the interrelationship of child and family. A child develops within a family. So what the family's needs and concerns are, what their priorities and goals are essential to the child's well-being. And if we provide child-focused services and family-focused services, those are the best way to obtain the best child and family outcomes possible. So we really need to address both as a unit. So the three core beliefs in family-centered care when we work with children are firstly, respect for children and families, appreciation of the family's impact on the child's well-being, and also family professional collaboration that is so essential. Oops. Sorry. So family and health provider partnerships are that we need to develop, we need to enable partnerships with families. And that's what we seek to do with the Enabling Inclusion Program, is to develop true partnerships where we provide families with the services that are needed for each family to address their needs and their priorities. And they are the ones who set the goals and the priorities for their families. Of course, it's along with the rehab professional. And we have to engage the family in the intervention process. So looking at the principles of family-centered care that have been well studied by various researchers, the principles are firstly respectful and supportive care. Then we need coordinated and comprehensive care. Specifically, if you're working with a team of providers, of healthcare providers, we need the coordinated comprehensive care. We need to enable the partnerships and collaboration. We need to provide parents with the specific information and general information which they require to be able to make the best decisions possible for their child. So at Amar, Seva, Sangam, we looked at all those opportunities for family-centered care. And we looked at the strengths of our program were that we were going to specifically focus on those that were the neediest in terms of support being in rural areas. Children and families in urban settings had greater services. We were going to focus on rural and the poor. We were also going to provide a program free of costs, which we are doing presently. We were going to provide equitable access to all families. And the program is village-based, either home or center-based, because we do have a few centers in different villages. We were going to provide a multidisciplinary team and also make use of the benefits from mobile connectivity and device use. Through the app, we were able to connect with families and with professionals through the app. Each team member having a tablet when they travel to be able to keep all of the information and intervention plans on the children. And we had great support by the administration and as well a funding grant from Grand Challenges Canada, which is a funding body in Canada which provides funding support for global health initiatives. Of course, there's always challenges to family-centered care, and challenges are, of course, the medical model of care, which is still very prominent in India and around the world. There's still quite a strong medical model of care. There's the traditional views of healthcare providers where we, the professionals, are going to fix the child and cure the child, perceptions of child disability, impacts of cultural beliefs, caregiver burden and social isolation, societal stigma, and often the service providers, the therapists, were not trained in family-centered care and coaching approach. It was new to them to be working as a team with the family. And of course, there's environmental barriers. So those were our challenges and opportunities in terms of providing family-centered care to the families that were benefiting from the Enabling Inclusion Program. And we saw that as an opportunity more so than a barrier for all the benefits that family-centered care offers. Secondly, I mentioned that the app and the model is based on the ICF, the WHO's International Classification for Functioning, Disability, and Health. And we applied it to child development. So hopefully many of you are familiar with the ICF, and I will review the various components because it is our essential guide for clinical practice in childhood disability and childhood development. So we know that the ICF framework is a biopsychosocial model of health. It's a multi-dimensional framework because it's based on 3 different domains of health and disability. We have the domains of body structure and function, activity, and participation. It's a universal model. It's used for all people, not just people with disabilities. It's a model of health and not just a model of disability. It's holistic and inclusive. So it focuses on the whole person and their environment. It's a strength-based model because it highlights what people can do, not just what people cannot do or on impairments. And lastly, it's an interactive model because it shows the interaction between each component and also the interaction between the person and their environment. So looking firstly at our 3 domains of body structure and function, activity, and participation. So we know body structures and functions are the anatomical parts of the body, such as organs, limbs, and their components, and physiological functions of body system. So it may be hearing, seeing, speaking, it's the range of motion, the muscle tone, the balance. So strictly body structure and function, what physiotherapists often look at, but need to look beyond, and what every therapist may look at, but need to look at how body structure and function applies into everyday activities. Then we go on to looking at activities. Activities are the function or the execution of a task or action by the individual. So everything, all the words that end in ing, walking, talking, eating, toileting, seeing, hearing. So, but using those more into all the everyday activities that everyday tasks that an individual must do. Then we go on to participation, and participation is defined as the involvement in meaningful life situations. So it's walking, but to do something, to play with friends, to go to school, to talking with family and peers, engaging in community life, inclusion in school activities. So it's really putting all of those activities and functions into a meaningful life situation. So what is a disability? Well, a disability is really the interaction between the impairments and the environment, as I mentioned earlier. And the disabilities can cover impairments. So impairments were our body structure and function. They can be activity limitations, and they can also be participation restrictions. Yeah, so impairment is a problem in body function and structure. Activity limitation is a difficulty encountered by the individual in executing task or action, and participation restriction is a problem experienced by the individual involvement in life situations. Oh, again, our friends who are participating in meaningful life situations. Now let's look at the contextual factors. What are the contextual factors? They are those elements below the environment and the personal factors that are so important. So the environmental factors have been found to have a major impact on one's ability to participate. They can be either supports or barriers to participation. So environmental factors can be either physical, they can be the built environment, accessibility, the area where people reside. They can be also social, social supports, peer support. They can be attitudinal, perceptions towards disability and recreation. They can be familial, family functioning, and they can also be institutional, policies and availability of programs. So, and we know that aids, assistive devices, and adaptations are facilitators. So there are many different types of environmental factors that can be either barriers or facilitators to participation. So much of what we do, much of as a therapist, as a facilitator, as an educator, much can be done at the level of the environment, environmental factors. So here is maybe challenges in terms of the physical environment. So looking at what different types of barriers exist. Well, the barriers could be through their absence or their presence. They can limit functioning or they can create disability. So we have physical environments that are inaccessible. We also have lack of relevant assistive technology. So provision of assistive technology is so important. And as well, negative attitudes of people towards disability or environmental barriers. We also have services, systems, and policies that are either non-existent or that hinder the involvement of people with a health condition in any area of life. So barriers are things to be addressed in terms of facilitating participation. What are facilitators in terms of the environment are, again, it could be through their absence or presence that they improve functioning and reduce disability. We have physical environments that are accessible. We have the availability of relevant assistive technology, positive attitudes of people towards disability, services, systems, policies that aim to increase the involvement of all people in every areas of life. So we know sometimes it's the absence of a factor that can be facilitating. For example, the absence of stigma or negative attitudes, that can be a facilitator. So facilitators can also prevent an impairment or an activity limitation from becoming a participation restriction. So so much can be addressed by addressing those barriers that are environmental factors. So that is really the a very important point in terms of promoting inclusion. Now, lastly, if we look at personal factors of the ICF, we have their internal personal factors, which can include gender, age, education, could be the profession in terms of an adult, could be past and current experiences, could be the character, motivation, likes and dislikes, and it could be other factors that influence how the disability is experienced by the individual. In terms of a child, often the personal factor is what motivates a child, what the child likes, what the child enjoys doing. And often in terms of defining some goals with the family, we really want to seek to see what the child really enjoys doing, what the child is motivated by. So what does it mean in terms for families and service provider? We know that the ICF framework can be used at home, at school, in the community, and for healthcare. So that's why our Enabling Inclusion app is based on the ICF. It enhances family-centered care. It's also a communication tool that promotes the conversation between family, child, and service provider. And I will get into that a bit further. And it's also organizational tools where we can set goals and highlight strengths and discuss the needs of the child, needs of the family, and needs of the environment. So now I will move on to the ICF, but a bit further into the ICF, and wondering, some of you may have heard about the F words in child disability that are closely linked to the ICF. And for some of you, this might be new. Well, the F words, which may be termed my favorite words, are based on research and built upon the ICF framework. And they are 6 F words that are important to all of children's development. And they remind us to focus on what children can do. And I have here the reference from Rosenbaum and Gorter from the CanChild for Childhood Disability Research at McMaster University in Canada. Yeah, so they came out with the F words in 2012, and this has become more and more quite prominent now, been translated into many, many languages, even various languages throughout India. So they were called the F words in child disability, and more recently, they have just been called the F words for child development, because it applies the ICF to child development in general, not just childhood disability. So let's look at what those 6 F words are. They are function, family, fitness, friends, fun, and future. And what these words relate to are all the domains of the ICF. So let's look at what has happened here with our ICF. Is that the domains have been replaced by the F words. So we see here fitness has replaced the body structure and function, because this is what it may be represented by fitness, strength, balance, range of motion, cardiovascular endurance, and so on. So we have fitness in that box on the left. In the center, we have function, because activity, walking, eating, dressing, toileting, so on, it's all daily function. It's things that we need to do every day. So the box in the center is now function. The box on the right is friendships, and that has replaced the participation domain of the ICF. Friendships is really what is the most important thing for children in children's development, is whatever activity they do with their peers. And this is what it becomes meaningful life activities. So that's why participation has become friendship. Family factors, family is the environment. It is where the child grows. The family is where the child is for the underage, and until the time they go to school, family is really the environment for the child. And that is where development occurs, and all the relationship within the family environment. And the last box to the bottom right, fun. Fun has replaced personal factors. As I mentioned before, for a child, personal factors, often it's what motivates the child, what the child enjoys doing. And each child is different. So it's really seeking, when we have goals, is seeking what the child enjoys doing, what the child wishes to do, what he would desire to be able to do. So fun has replaced personal factors. So this is a very nice, this has replaced a very nice framework where they have put both the ICF framework and the F words together. So it really defines exactly what is essential to a child's development. And again, this is any child. Any of you who have a child at home may look at all these elements and be able to look at why every element here is so important. And this is where we also seek to find the goals with the families. Once we do our assessments and look at families' priorities for their child, we are able to find goals in each of these domains to have a holistic intervention plan with the family. So again, there's various versions of it. Here they have put the ICF and F words in separate boxes. And this is the latest framework where they have actually united the both the ICF framework and the F words. So it's what really matters to for childhood development. And there is also, if you compare, this one is for the child, this one is for the adult. And it's really for every human being. These are the important elements, as the ICF has described. And it also, these words, fitness, function, friends, family, and fun, are also the important elements of human beings. And you will also note that at the bottom, there is an arrow that goes through, which says future. And future is that one day the child will grow up and wants to develop independence and inclusion. So it is also what their long-term goals are. So we can also always find more short-term goals and their long-term goals in terms of their future desires, what they would like to do in the future. That becomes that bottom arrow for both the children and the adolescent or adult. And again, there's various versions of these posters. This one was done for the World Cerebral Palsy Day. It's on the World Cerebral Palsy Day website. So the 6 F words for child development. And it has been, this one is the 6 words for cerebral palsy. And there's, again, you can go to the canchild.ca website and there's various videos, and it's been translated into many different languages and various Indian languages as well. So this one we have on the wall at Amar Seva Sangam. And there's various ways to look at the goals in each of the domains. And again, it's the integration of the ICF domains, and it's family-centered, it's child-centric, and it's really looking at a way to be strength-based, things that the child wishes to be able to do. And we also may be able to ask questions to the child, to the parents, in terms of giving us more information about what they are presently doing, what they wish to be able to do, what challenges they may have. So just an idea of the many ways that we can engage the family. So
close madiki anta ಎಷ್ಟು ಹೇಳ್ತೀನಿ.
Hello. So lastly, so I just wanted to give you, there's a lot that I could speak for not many more hours on how to use the F words in childhood development or childhood disability, in terms of setting goals for participation goals. But just I just wanted to be able to share with you how these favorite words have been included with the ICF, and they focus on the abilities and potential rather than disabilities. And they're really a positive way of looking at goals, looking at function for both children and families. Yeah, and there's different people can add their goals, add pictures in terms of setting, developing a plan of what they wish to be able to do. So again, goals and why. So just a bit of sharing about the F words. So the take-home message for that, for what I've been covering till now, is that implementing family-centered services are really what's best for both child and family outcomes. So this is what we wanted to include in the Enabling Inclusion app, that we wanted to also have the ICF framework and also be guided by the F words for goal planning and providing services. And we want to maximize each child's potential because we want to work on children's strengths and really optimize their development. And our ultimate goal is participation into meaningful life activities. And that is what inclusion really means. So there's many F-word resources which I can share. And these are our children at Amar, Seva, Sangam. And now I will review what our app and model was fully, the full development now of what it includes. Now that I have covered what the family-centered care includes and what the ICF really means, let's look at how we develop the model. So I just a word right now of where we are at presently is that, well, our main funder for the Enabling Inclusion model in Tamil Nadu is the government of Tamil Nadu's Disability Department. And they fund Amar, Seva, Sangam for the program in 2 full districts of Tamil Nadu. And that is covering 2,100 actively enrolled children. We also have the Ajim Pranjib Foundation, which covers 1,000 actively enrolled children in 1 full district of Tamil Nadu. And these programs are home-based early intervention and child rehab services. Oops. And we are also building partnerships with various NGOs. Right now, we have 6 other NGOs which have a license with the EI model and app. And so the EI model has been replicated in 3 other districts of Tamil Nadu, as well as in Assam, Uttar Pradesh, and in West Bengal through various NGOs. So if we look at what our model includes various modules, and all these modules are within the application, the app. So we have, top left, we have validated screening tools. Then we have also an ICF-based child and family assessment. We also have standardized evaluations that go across various developmental domains and ICF components. Top right, we also have family-centered goal-setting tools. We also have parent-reported outcomes and caregiver measures, because we also care to know how the family is doing. We also have then an intervention plan, and our intervention plan is needs-based and also based on the domains of the ICF. We also run family empowerment groups, peer support groups, capacity building. We also have social media outreach, livelihood, and assistive technology provision. And now to the bottom right, we also run community disability awareness programs and inclusion groups for community, women, and students. And lastly, we run training programs for child development workers, health workers, teachers, and parent groups. So just to describe a bit the cycle of the EI model, firstly, we have children that are screened for developmental delays or developmental disabilities. Once, if they are screened positive and need services, they are assessed by our rehab specialists, who are physiotherapists, speech trainers, special educators. We also have OT. And once the assessment and treatment plan is developed along with the family's priorities, we have community rehab workers who visit the families on a weekly basis. And we have rehab specialists who work along with the community rehab workers and support the community rehab workers within each village where they work. So we have therapy in the child's home. We have also been using tele-rehab during the pandemic. So a mix of tele-rehab and in-person services. So services are provided by both the CRWs and the rehab specialists. There's reevaluations that occur every 6 months, and we reset the treatment goals and plan. So the app is in a secure cloud-based environment, and all the information on each child and family is stored within the app in a secure environment. So all of the various modules, which I described earlier, from screening to assessments, all the goals that are set, the treatment schedule, everything is stored within the app. So whether the CRWs, the community rehab workers who travel to various villages, or the rehab specialists, all the information and treatment plan is stored within the app. And every therapist and CRW has a tablet that they travel to visit each family, so that all the information is there. So we know that the app is good for both mobile or web. It's designed to be used for children. I know there's lots of information right here, but it covers all developmental domains up to age 10. We are now including a portion up to age 18 that will be having vocational goals for children that are and more academic and vocational goals for from age 10 to 18. So all of the elements, and tele-rehab is also a portion that has been added. So just to have a visual of the validated screening tools that are within the app is the Trivandrum Development Screening Chart. And we also have the UNICEF Washington Group Child Functioning module within the app. So those are our two screening tools that are used often at health centers, at Anganwadi centers, and so various screening camps that where we see children to screen for developmental delays or disabilities. Then we also have a child and family assessment, which is ICF based. So for each of the domains, we have a series of family-friendly questions that addresses all of these areas. So we ask families about various questions, as I demonstrated earlier, that may relate to all of these areas. So this is a very in-depth assessment that may be done by any health worker or community rehab worker that is provides a wealth of information on which priorities and goals may be set. We also have some standardized evaluations that may be used across different developmental domains and ICF components. We have the gross motor function measure. We have the WFIM, which is a pediatric functional independence measure. that looks at self-care, mobility, and cognition. We have the COM deal, the communication developmental checklist, and we have the FACP, the functional assessment checklist for programming. We also have various specialist assessment which may be used, a physiotherapy assessment, a special education assessment, which includes checklists for autism and ADHD, a communication assessment. We also have functional vision and functional hearing assessments. And we have an environmental assessment that looks at the home and the community where the child lives. Some of our friends. Finally, we have family-centered goal setting and caregiver measures. We really want to know, as part of the family-centered approach, we want to know what the family's priorities are. So we use a tool called the COPM that looks at what the family really wants for their child. We go through a day with their child and we ask the family what is important to them and what do they see as a goal for their child. And that is where we may go into the F words to look at what really matters to them, what their perceptions are of what they feel their child really needs and what they want to work on as part of the daily routine. We also have some caregiver measures that may be used, and we have the family empowerment scale, where we measure family empowerment. We have the modified caregiver strain index, and we have the caregiver child interaction measure. And we measure those every 6 months to look at how the caregiver well-being is, how the family's burden is, and we have found really very good outcomes in terms of lowering the caregiver burden with the support that we are providing. So the intervention plan is developed. We use a coaching approach with parents, and coaching approach has been shown to be the best evidence-based practice in terms of teaching parents how they can facilitate development of their child on a daily basis, even when the CRW or therapists are not in the home. So we coach the parents. We use also a train-the-trainer approach, where the rehab specialists provide continual training to the CRWs on how to best provide the intervention when they go to the homes. We provide assistive devices, and we have done a lot of fundraising to be able to provide many assistive products free of charge to the families for those that cannot be obtained through governmental funding. And we also run medical and surgical camps with specialists. So some of our friends again that we visit, and that's me right there. And some of the assistive devices that we provide for to enable participation. So these are the community-based awareness programs that we run, community, women, and school awareness. So the goal is to disseminate knowledge and understanding of health, disability, and also to make them aware that early intervention services are available and are important. We want to reduce stigma and attitudinal barriers towards people with disabilities in the rural areas, and also to promote inclusion within their village, society, and the school system. And lastly, we run parent groups, family empowerment groups, and advocacy, where we work with families with parents to support them in terms of providing whether general information, specific information, peer connection and mentorship. So, and also the parent-to-parent support, self-help groups for livelihood initiative. So, and now we are starting to have family-run groups. So this is really right now taking off in many different ways to build caregiver capacity building. And during this pandemic, we have done a lot with WhatsApp, video sharing to review goals and interventions. We have WhatsApp parent groups by blocks. Some are parent-led. We have some WhatsApp groups by age range and diagnoses, with the healthcare provider providing general information. We have Zoom parent meetings and phone calls for families without data. So the outcomes are of our EI model and app are at this time that we have some 70,000 children who have been screened for developmental delays or disabilities. We have more than 4,000 children and 9,000 caregivers who have benefited from services and shown positive child and family outcomes. And we have more than 90,000 who have participated in community awareness programs. And those are still at present time running full speed ahead, with weekly, in various villages, there are women, community and community awareness programs. Schools, when they reopened, do have programs there when the children are in school. So various outcomes that we have shown through our various studies are that there are positive child developmental outcomes, and we also have improved the caregiver well-being at the same time. We have changed attitudes and societal stigma. And we've been able to provide services at the child level, at the family level, and also at the community level. We've been able to provide parent support and participation. We have also improved the caregiver knowledge through the coaching approach. We want to empower parents to be able to work with their children and to facilitate development. And overall, overarching is the partnership that we develop with families. So we've been able to achieve both the individual child and family goals, as well as caregiver well-being and empowerment, and child participation, quality of life, and we've also improved school enrollment. So we have some recent publications that have demonstrated that our family engagement, school enrollment, and quality of life have shown significant change, and also that the caregiver of children with developmental delays have greatly been impacted by the services that have been provided. So the way forward is that now we have onboarded 6 NGOs, and we are growing in terms of being globally recognized, and we are scaling up right now through global LMIC partnerships. And the EI model has been shown to be cost-effective, equitable, and a sustainable home-based early intervention and rehab program. And it's really having impacts on child development and social inclusion. Now we are proud to say that we have won many awards, and just actually yesterday or the day before was we were awarded the Mary Glowry Disability Award for our early intervention program. We won the Spindle Award for Digital Innovation, the Zero Project, where we presented at the United Nations in February 2019 for the Inclusive Education Award. And we also in 2019 won the World Cerebral Palsy Day Award for Medical and Therapeutics again for the early intervention program, MIT Solve, the Microsoft Opportunities Award, and Asian Prenji Philanthropic Initiative funding. So very proud of the recognition that's been received. So I'd like to once again to thank all of our funders who have enabled us to develop the EI model and app and our research partners, and we have ongoing research at present time, as well as our software developers. And some of the contact information, and you're welcome to come visit us on our website at earlyintervention.amarseva.org. And we are on Facebook, Twitter, LinkedIn, Instagram, YouTube. And this is great memories of being at Amar Seva Sangam with all of our buddies there. I wish I could go back soon if COVID just goes away. And I thank you very much for your attention, and I will welcome some questions. And if I ran over time, I'm sorry, I have too much to talk about.
Thank you so much, Mary. It was a wonderful presentation, and then
Welcome.
for taking us through this enabling inclusion. So you enlightened us about the different perspective of ICF integrating F words. It was a very new concept for us, and I hope all the participants who are attending this webinar will also be appreciating this concept of integrating F words in our ICF. And then, is there any questions? You can just. So if you have any questions, you can just throw it in your chat box. So Mary would be happy to answer us. So Mary, I just want to, I have a question. So
Yes.
you're from Canada, and then, so what made you to come all the way from Canada to Ayikudi, Tamil Nadu? So what was the inspiration behind working for people that too in a very remote corner? So Ayikudi, even, I don't know where's that place it. Okay.
Yes. Am I unmuted? Yes. See, I have been a pediatric physiotherapist now for this is my 40 years. So I actually I retired 5 years ago, and then, but my goal, my life goal, after I finished working at because I worked at the Children's Hospital and Children's Development Center for all of those years, and lectured university and research and so on. I wanted to dedicate my time to global health, and all the knowledge and clinical skills that I had, I wanted to share abroad. So I went to Bhutan. I did some capacity building in Bhutan as a volunteer with HBO, held volunteer overseas. And then I came to know about Amar Seva Sangam because they have a partnership with Handicare International, and Handicare International being their fundraising partner in Canada. And how Amar Seva Sangam developed the model and the app was through much funding through Grand Challenges Canada, which is a funding body in Canada that funds global health initiatives for child development around the world. So I became aware of this, and I thought, that's how I became involved. I had a lot of background in family-centered care in Canada and the ICF and the F words. I had done a lot of research, various research studies with CanChild, the CanChild Center for Childhood Disability Research, where all of that knowledge was developed through the 1990s, the 2020, and for years. So I thought, what better way to share my knowledge, my expertise, and I was very excited to see what was being developed, and I am truly excited about how all the best practice and in the field of childhood development have been brought together in the enabling inclusion model for the ICF, the family-centered care, and the CBR approach. So I have been there 3 times in Amar Seva Sangam for a total of 6 months. I have my saris, my kurtis, and I can speak some Tamil, and I wish to go back very soon.
Thank you. And then we have a question from Dr. Abu Simpi. How can we use ICF for quantification of functioning, especially in children? Also, there are any central process for using this as a global tool?
Yes. Can we use it quantitatively?
Quantifying of functioning, especially in children. Also, there are any central process for using this as a global tool?
Yeah. Well, right now, I'll just respond. Yeah. So as a global tool, the enabling inclusion app is right now we are welcoming. If somebody could.
Yes. Just hold on.
Yeah, the way, okay, firstly, how do we quantify child development? Child development through the ICF is quantified through the various tools that are within the app. So the various tools that are within the app address all the different components of the ICF. We have the tools that I have described. Some of them are at the body structure and function. So for example, the physiotherapy assessment, the communication assessment, the various special educators. Some are at the body structure and function. You can measure the range of motion, the strength, the balance. You can measure the addictivity level. And we have the GMFM, we have the FACP, the ComDeal. So you can measure within each domain of the ICF. We have outcome measures that belong in those domains that measure function, whether it's gross motor, whether it's speech, whether it's the fine motor skills, self-care. So we have precisely put in standardized outcome measures that will measure what the constructs of those ICF domains. And we can measure participation through the goals that have been set, that are participation goals. So, and then we also have environmental assessments, and we also have environmental interventions that will measure change within the environment. So we can address every domain of the ICF through the various measures that are within the app. Okay, so they can be quantified. And then in terms of using it globally, the app is right now welcoming, and we are right now in negotiations with various global NGOs beyond India to develop partnerships where Amar Seva Sangam provides the training, the licensing of the app. We provide the capacity building. We provide the IT support. So it is a partnership and licensing through Amar Seva Sangam for the EI app.
Yeah. Thank you, Mary. And then this Mr. Rajeshwaran from Amar Seva Sangam has raised his hand.
Oh yes, Rajeshwaran. Yes.
Rajeshwaran, yeah. So over to Rajeshwaran. Yes, yeah.
Hi.
Hi, Rajesh.
Yeah, hi Marie. Hi everyone. It is. Can I share my thoughts because Marie is one of our great asset of this program. Actually, she participated in a lot of things in this program. First of all, I am Rajeshwaran. I am the chief accountant and the chief operating officer of this inclusive education program and inclusion development program. So Marie is actually, she came to Amar Seva Sangam 4 years back, 4-5 years, I think. And her experience in the EI, the early intervention, is really amazing. Especially, she only brought into this concept of family-oriented approach, because she is very, very what about that, interested and very focused on this family oriented approach. And actually, that is the excellent concept. We realized once we implemented these things in our program, because we got a lot of recognition, and we got a lot of development in the child, and also the very good inclusion in the family. That is the most important one which we are seeing, because the family is the most important one for the child who is having the problem in the development delay. Like the parents are the primary caretakers who will be in a position to understand and support the kids for their the wonderful life. So that this approach has lightened a lot of things in the children's life. So I would like to thank Marie, especially for this kind of wonderful knowledge and support. And she is our research consultant in our program. And we know that she'll always be in support with us. And we are looking forward to have a visit of Marie. And also in this platform, I take this opportunity to invite all the participants in this program to visit our website, Amar Seva website, and our early intervention website. And if possible, the projects what we are working on is especially in early intervention, and have a chance, please visit our organization. And we are looking forward a good hands like you to have a partnership and disseminate this knowledge and give the rehabilitation to the society. Thank you.
Thank you so much, Rajesh. Thank you so much.
Thank you so much. Right.
Thank you for your input.
And then Mary, there was one question. Can we access the app anywhere and everywhere, or is it for a specific area?
No, it's you can access it anywhere, but you can't just go on Google Play, and you need Rajesh, maybe you can you need licensing to use it, like you.
Yeah. Actually, this is the app we designed, but the thing is, it requires process flows because it requires number of licensing access. And who are all interested in our app, you please contact us. We will share our emails because Mary has everything, so that we will share the things. You please let us know. We will share the test logins and others. You can go through and have a look into it and have an experience and let us know.
Yeah, and we have various demo videos, some shorter, some longer, that can be viewed on our website that explain the app. So, but what's great with the connectivity that is in India, people can access. You can access if you have the licensing and the established connectivity. You can access it in most places. If you are in a far out of reach area, sometimes you can upload the information once you get to an area where you do have connectivity. But yes, so that's you can contact us and we will provide more information. I'm just reading also the I'm just trying to scroll down the chat box.
Yes, Mary. Yeah. And then there are not much questions. Okay. And then on a closing note, I would like to invite Dr. Sarath Babu, Principal, MGM Institute of Physiotherapy, for sharing his thoughts on this webinar. So over to Dr. Sarath Babu.
Yeah. Am I audible, sir?
Yes, sir. You're audible. Yeah.
Thank you so much. On behalf of our MGM Institute of Physiotherapy, I really express my gratitude to Mary Brien for accepting our invitation for this wonderful webinar. It's a really wonderful session. It's an informative session to one and all. Mary, I have a few questions to ask. like what are the challenges you have faced while implementing this enabling inclusion app to the Amar Seva Sangam? Can you share a few things?
Yeah, there's if we look at challenges, there can be challenges both on the service provider aspect, like the therapists or the who and there's challenges on the caregiver or parent aspect. I guess if we look at a service provider, whether it's physiotherapists, educators, speech trainer, I know from physiotherapy school, you are trained more, maybe more so also in India in the medical model of care, which is gradually evolving to be more family centered. And also, if we look also on the aspect of the families are used to the medical model of care, where doctor knows best and doctor will cure or doctor will fix my child. So right now we believe that best practice, and it has been shown, is really the partnership with the family, so that they become an integral member of the team. So it's also training the service provider in how to engage in a conversation with the family. What are your priorities? What are your goals? And then coaching the parents into, this is how you can, encourage your child to do this. This is how you can, so empowering the families. It's not the therapist doing the therapy. It's more the therapist or the CRW coaching the parents to work on the goals that they have as priorities. So it's both, it's a change from the medical model of care to the family-centered approach. And also not looking just at impairments, which I know as therapists, sometimes we look at just impairments, let's just work on the range of motion or the strength or just the walking, but it's doing the skill to participate in life activities for a meaningful activity. So not just walking for the sake of walking or sitting just for sitting, but sitting to be able to eat, or walking outdoors to be able to play with friends, or so it's really going towards participatory goals, not just working at body structure and function. So it's being more progressive in terms of moving towards participation in the ICF, being more family-centered. And there was work to be done both on training the service provider and the therapists and CRWs, and also our approach with families, if that answers your question.
Yeah, sure. So you have done an excellent job. And along with you, any of your team members are working with you from your country?
Pardon me?
Apart from you, any of your team members from your country are working, contributing towards this Amar Seva Sangam?
Oh, yes. Well, we have partnerships with various Canadian universities. And we have also, when it's not COVID times, we have students that are master's students from various Canadian universities who come to do placements in physiotherapy, occupational therapy, that come to Amar Seva Sangam.
Oh, nice.
Right now we have various clinical affiliations with various universities throughout Canada. So there's a real partnership, Canadian-Indian partnership with Amar Seva Sangam. We have ongoing research studies right now, looking at some child outcomes, looking at impact of parent groups. We are developing a school inclusion program. So we have various partnerships for studies right now, both clinical and research with Canadian universities. So I guess I'm the one who's on board officially, like at all times. who's always involved continuously, but we are bridging with many different partners in Canada. Yeah.
Okay. So do you find language was a big barrier?
No. No. Banakam, Nile Ukaru, sit, stand. No. I use a lot. I'm not English, I'm French. So, but I like to talk, I like to demonstrate if I'm working with either families or children or therapists, I like to demonstrate a lot how to do something. So it's the nonverbal and also the facial expression, and I show families something, and of course I like when if families do not have, if we cannot communicate, I have somebody to translate, but I have not found that it's been a big barrier. I mean,
okay, nice to hear. Yeah. Thank you so much, Betty, once again. We are looking forward from you more sessions.
Yes, and I'm sorry, I had so much to talk about, so I tried to put everything into this one lecture, but yes, I'm very passionate about the subject, so I can speak at for later dates again. And we will be having a webinar series, child development webinar series, starting at the end of January, once a month, with the Enabling Inclusion Program. And Amar Seva Sangam will be putting out invitations on various topics. So that will start late January. It will be once a month on various topics. So for those who wish to join us in the future.
Yeah, sure.
Yeah.
Also, I would like to thank Dr. Das Prakash for and his team for organizing such a wonderful webinar. Thank you, sir. Over to you, sir. Das, sir.
Thank you, Dr. Das.
Yeah.
Mary, and then on a closing remarks. Mary, really you are an inspiration for us after listening to the stories, because early intervention and then reaching to the communities is a challenge. We know most of the people, those who work in musculoskeletal, cardio, neuro, they work within the clinics or in a setup, in a hospital setup. But walking into a community is a great challenge. And then particularly with the children. I remember the slide of you, which you shown the truck which was overloaded. I just remember so how difficult it is to reach to the community. That's number one. And the second biggest challenge is reaching to the community with the technology. It's and then you're moving ahead, and then we congratulate you, and then we appreciate you and the entire Amar Seva Sangam for drawing inspiration, for giving inspiration to all our budding physiotherapists. And then on behalf of MGM, Mahatma Gandhi Mission and MGM Institute of Physiotherapy, and if you're coming to India, we would like to have you in our campus, in our Aurangabad campus, and then
Definitely.
to have a one-to-one session with our students and with our faculty members, and you can visit our facility. On a closing note, I would like to request Dr. Sharat Babu to present the certificate of appreciation to Mary Brien. And then we are celebrating our 39th Foundation Day of Mahatma Gandhi Mission. And then we are glad that we had this webinar on this occasion of 39th Foundation of Mahatma Gandhi Mission. So I'd like to request Dr. Sharat Babu to present the certificate. Yeah, thank you. Thank you, Gunandan.
Thank you so much. Thank you so much. I was very, very happy to have joined you. Yes.
Thank you.
And I will definitely go, and I will definitely visit you when I go back to India.
Thank you, Mary. Yeah.
Thank you,
Yes,
Mary. Thank you, Mary.
so much.
And then
Okay.
I think it's a long day for you. I think you want to go and sleep. I don't know what's the time now there in Canada.
Yeah, it's what 1:15 a.m.
On 15 a.m. Oh, sorry. Okay. So thank you.
But I still have passion for this. So
Okay. Thank you, Mary.
okay.
Yeah.
Thank you
Thank
all.
you. Yeah.
Okay. Bye-bye.
And then we will be sharing the feedback links to all the participants. Please share your valuable feedback in the form, the Google Forms. Yeah. Thank you.
Thank you all. Thank you. Bye-bye.
Thank you. Thank you, everyone. Bye.
Thank you. Feedback forms.